Okay, so we're going to go ahead and get started. So I'm going to welcome you all to our last grand rounds of the semester. We are greatly honored to have Dr. Daniella Thorne, who is the Associate Director for Sexual Health Education at Advocates for Youth, Inc. I hope some of you, or a good number of you, know Dr. Thorne. So I think we will be all treated to a very engaging presentation that she's entitled Let's Play Taboo, the State of Sexual Education in America. And I'll let Dr. Thorne sort of update herself on anything else you want to add. And I'll turn the mic over to Dr. Thorne. You should have access there, and I know you checked all that. So I'm just going to turn my stuff off and just let you take over. And just a note to everyone, please, if you have questions, you could either go ahead and add them to the chat as Dr. Thorne presents, or just save them to the end when we have Q&A. All right, Dr. Thorne, the floor is yours.
Thank you so much, Dr. Telfair. Oh my goodness, it is so exciting to see so many familiar faces and names in this space. I'm really excited to be here with you this afternoon. I said to a couple of people earlier, you could have been anywhere in the world and you're here with me, so thank you. So good afternoon. As mentioned, my name is Dr. Daniella Thorne. I'm going to have a talk with you today about the state of sex ed in America. Is it taboo? To be determined. I bid you greetings from Advocates for Youth, which is an organization based out of Washington, D.C., and I'll share a little bit more about Advocates in a second. But first, a little bit about me. So I came into this work as an educator. I was a health educator at an all-girls charter high school in Albany, New York. And I found myself really, really attached to and really finding the most joy and gratification out of teaching the sexual reproductive health unit to my young girls. And as a result of that, I was like, wow, how can I create curricula and really make sure that my students have access to information around their sexual reproductive health from people that look like them, right? How can we create culturally relevant curricula? And so that led me into some place called Statesboro, somewhere in South rural Georgia, where I decided to pursue a doctorate of public health. I graduated December of 2017. Special shout out to one of the members that was on my dissertation committee, Dr. Smallwood. It was great, arduous journey, right? This Brooklyn girl comes down to South Georgia and decides that she wants to research sexual reproductive health among adolescents. So that was very colorful for me, but know that I completed it. So there is a light at the end of the tunnel for those of you who are still doctoral candidates. And so I came to this work as a student as well. Now my work kind of looks like mentorship. And so I support dissertation students, graduate level students, undergraduate students who are interested in sexual reproductive health. I find the most joy in that because I know what it is to be in a place of really trying to find your way through this field. And so I find joy in that. My day-to-day is a capacity builder. And so I provide technical assistance and capacity building to 28 school districts throughout the country that receive CDC DASH funding. And DASH stands for the Division of Adolescent School Health. And so I support them around all things sexual reproductive health education. That can be assessing curricula, that can be selecting curricula, providing trainings for the educators who are about to teach sex ed. It looks like a lot of different things, but that's what I do typically for the day-to-day. But in life, in general, I'm an advocate specifically about sexual reproductive health. And so, you know, Thanksgiving is always an opportunity for me to get on my soapbox and try to describe what I do for work, but most importantly, advocate for the access of sexual reproductive health education that our youth really need. And so I mentioned I work for an organization named Advocates for Youth. Advocates for Youth partners with youth leaders, adult allies, and youth-serving organizations to advocate for policies and champion programs that recognize young people's rights to honest sexual health information, accessible, confidential, and affordable sexual health services, and resources and opportunities necessary to create sexual health equity for all. Highly encourage you to check out our website. We have a lot of resources, not only for educators, but as well as parents, for youth. We're currently taking applications for our youth partnerships as well as our alliances. And so I just encourage you to check out the website. There's a lot of great stuff on that website. So let's get grounded for our time here today. My hope is that you're able to be as participatory as you care to be. You're open to learning, and most importantly, you take care of yourself. For some, this topic can be a little bit, it can bring up old feelings. It can be hard, it can be easy depending on what your own personal experience is with sexual reproductive health. And so I encourage you to take care of yourself as need be. If you need to scarf down your lunch as I'm chatting, go ahead and do so. So what are our objectives? Well, it is my hope that by the end of our time together, you are able to explore current youth sexual reproductive health trends. You're able to examine sexual education policies throughout the country. And lastly, identify some current challenges and opportunities for sex ed. And how are we going to do that? So here's our agenda. We'll discuss what's happening. We'll look at what we can do about it. We'll also look at what does policy have to do with it anyway, right? We'll look at why we should care, as well as who can address sexual reproductive health. So I'd like to start off with some chat box chatter. So if you're able to, I would love for you to type in the chat box words that come to mind when you hear sexual education or sex ed. So go ahead and drop that in the chat box. And you can type as many words as you can think of. Okay, Dr. Smallwood, I saw that. You sent it to me, not to everybody, Dr. Smallwood. Okay. All right. So Dr. Gemma says comprehensive, medically accurate. We have abstinence, safe sex practices, STI, HIV education, understanding healthy relationships. Ooh, Dr. Chopak said limited. Practicing safe sex. Okay. What else? What other words come to mind when you hear sex ed? Ooh, politically charged. Okay, now we're getting into the juicy stuff. Chelsea says necessary. I agree, Chelsea. Knowledgeable of harm, virus versus violence, shielding the youth. Hi, Dr. James. So good to see you. Okay. So here is a task I would love for a fearless participant to do. Remember, I said be participatory. If you wouldn't mind unmiking and sharing in the room, how would you go ahead and define sex education without using any of the words that's in the chat box? Who would like to be my fearless participant and try to not use the words that's in the chat box to describe sex ed?
I volunteer, Dr. Thorne. I'd say in the context of youth, creating this space to provide or eliminate adverse health outcomes in the future. And that, subsets of that is violence prevention.
Violence was there. Ding.
I'm already out.
Thank you, Tanya. Anyone else want to try? Who thinks they can describe sex ed? But Tanya's good. Tanya said preventing adverse. I forgot the last word.
Health outcomes.
Health outcomes. Love that. Anyone else want to try? How would you describe sex ed without using any of the words that's currently listed in the chat box?
I'll add culturally relevant isn't on the list.
Okay. So what's your definition, Gemma? Dr. Gemma?
Providing culturally relevant, I think I already added affirming on there.
Okay. Thank you, Dr. Gemma. Dr. Stacy Smallwood, you go ahead and try and we'll move on.
Okay, so I would say providing information about how to care for yourself and for the people that you love.
Okay, good for you. Talk about synonyms. You all were really reading the thesaurus, and I love that for you. So thank you all for participating. What you'll see is that for some, right, like Tanya started off and like hesitated because a lot of the words that you use is typically what people think about sex ed, but oftentimes sex ed is seen as a taboo topic, right? And when you're not including words like education and you're not including words like health, it makes it a little bit challenging, but sex ed does not have to be taboo. And what we know is that the state of sex ed in America has really become a taboo topic, unnecessarily in my personal opinion, but let's ground ourselves on what sex ed is for the purpose of this conversation. So For the purpose of this conversation, sex education is the provision of information about bodily development, sex, sexuality, and relationships, along with skill building to help young people communicate about and make informed decisions regarding sex and their sexual health. And so sex ed can include a slew of topics. And so here are some: abstinence, anatomy and reproduction, healthy relationships, puberty, refusal skills, STIs, sexual violence prevention, birth control, etc., pregnancy options. And when you get into conversations around pregnancy options, gender identity, sexual orientation, that's where we oftentimes see the most taboo of sexual reproductive health education. Now, what's really happening? So now it wouldn't be a public health presentation if we didn't talk about data, right? We have to talk about data. And so what I'm going to do now is present to you some data from 2 national surveys. The first one being the Youth Behavior Risk Survey. This is information about trends data from 2011 to 2021. And so firstly, we're going to look at this section. This section is around sexual behavior. And I want to bring your attention to the areas that have the red stop sign. What this is showing us is that, unfortunately, these topics are increasing. So over the last 10 years, we're seeing an increase in the numbers. So firstly, high school students responded to this survey, and we see that there has been an increase from 2011 to 2021 that students are using a condom less. Okay, so less students use the condom during their last sexual intercourse experience. Additionally, we see that less students are testing for HIV and less students have tests for STDs during the past year. This is pretty alarming because what this is telling us is that youth are engaging in sex and they may not be using a barrier method, nor are they getting tested. So naturally, not using a barrier method makes you exposed to potential STI infections. I want to do a quick content warning. Remember, I said take care of yourself as necessary. The next couple of slides, we'll talk about violence, sexual violence. And so however you need to take care of yourself as I go through these next couple of slides, please do so. And so this section of the Youth Behavior Risk Survey looks at experiencing violence among our high school students in the US. And so bringing your attention again to that red stop sign, we see that there has been an increase in our youth who don't feel comfortable going to school because of safety concerns. Additionally, we see that there's been an increase in youth who have been forced to have sex. And lastly, an increase amongst youth who have experienced some form of sexual violence by someone. And I chose to break down these demographically, and so we get a better idea of who is most at risk. And so what you see at the end of this slide is that our LGBTQ youth are experiencing higher rates of not feeling comfortable going to school because of safety concerns. Additionally, our LGBTQ plus youth have been more likely to be forced to have sex. And lastly, have experienced sexual violence. And so what is that data telling us? You can drop it in the chat box, or you can go ahead and unmic and speak into the room. What did that data tell us? Well, I'll tell you what it told us. Nearly 1/3 of our students in the US have ever had sex, but more than 20% of them are sexually active. Only half of them have used the condom during their last sexual experience. And we've also seen an increase in the number of students who do not feel safe going to school, who have been forced to have sex, and who have experienced some level of sexual violence. And so one thing for sure we know is that our high school students are absolutely having sexual intercourse. Right? They may not be using protection as often as we would like. They may not be getting tested for STIs as often as we would like. And we know that our LGBTQ youth are at risk of increased violence. And so what can we do about it? Well, the CDC has a framework called What Works in Schools. And this is a framework that really has a 3-pronged approach. Firstly, they think that in order for us to address reproductive sexual health and just really health and well-being among adolescents throughout the country, we need to make sure that our schools are safe and supportive. Right? What does that look like? Are there mechanisms in the schools where violence can be reported? Are there programs? Are there activities that these students can feel welcomed and appreciated and feel comfortable going to school? They also think that it's important for us to connect our young people to health services that they need. So what health services are in the school building outside of the nurse? Is there a sexual reproductive health clinic that if a student wanted to be tested for STI or HIV or get contraceptive methods, they have access to that? And if there is no clinic in the school, is there a seamless referral process to a community organizer and or a community clinic where that student can get resources? But lastly, the CDC says that we need to improve health education, right? Do we know that our students even know the efficacy of condoms? Do they know where to get condoms? Do they know how to use condoms? Do they know how to get consent? Do they know how to give consent? These are all skills that you can learn while in sex ed. And so the CDC also recommends 22 sex ed topics. And I'm not going to go through all of these, but some of them are the similar things that I just mentioned, right? So the importance of using a condom consistently and correctly, the importance of using a condom at the same time with another form of contraceptives to prevent STDs and pregnancy. How do gender roles and stereotypes affect goals? Additionally, the CDC thinks that another set of things that you should know how to do is how to create and sustain healthy relationships, how to communicate sexual consent between partners. And so this is like the gold standard. This would be ideal, but I'm sure you're wondering, like, how many students actually get access to all 22 of these topics? Well, I'm glad you asked, because that's what I'm here for. So right here you see highlighted is the School Health Profile 2020 data, in which we're able to see how many middle school and high school students have been taught all 22 topics that I just mentioned. And so you'll see that in middle school, only 24% of United States middle schools actually learned all 22 of those topics. And 44% of high school students learned all 22 of those topics. For context, though, most schools and most counties only teach health education in 9th grade. And so folks, it says 9th, 10th, 11th, and 12th, but typically speaking, even if you think about your own high school experience, high schoolers learn it in 9th grade, and then 10th, 11th, and 12th, they might be taking ceramics, they might be taking some other elective that they're interested in. And so context that there's a possibility that as students get older, they're not getting this information reiterated to them. And so how does policy impact this? Well, here's the thing. In the United States, 38 states require HIV education, which that feels good, right? That's more than 50, but that's only HIV education. 29 states and the District of Columbia actually require sex education, which doesn't feel bad, but 19 states require instruction on condoms, contraceptives when teaching sex ed. Only 19 states in this country require instruction on condoms and contraceptives. Additionally, 16 states still in 2023, y'all, provide abstinence-only sex education. And so for context, abstinence only typically means you only engage in sexual activity until marriage, should that be your own personal goal. 9 states have policies. Only 9 states have policies that include affirming sexual orientation instruction on LGBTQ identities or discussion of sexual health for LGBTQ youth. Think about the impact of only those 9 states when we thought about that data that we saw earlier. And unfortunately, 6 states explicitly require that instruction discriminates against our LGBTQ people. Sad. So let's talk about it. DeSantis is the governor of Florida, and he is looking to expand his Don't Say Gay law to high school. So you're probably thinking, for those of you who are not in this work, what is the Don't Say Gay law? Glad you asked. The Don't Say Gay law is a law that has been enacted last year in Florida, and it's only been enacted in Florida, that says that there is to be no education around gender identity or sexual orientation in grades K through 3. Why is that alarming for us in the field? Because we know that this is the prelude for an extension from 4th through high school. And that's what we're seeing, that the intention is that this Don't Say Gay law, which is essentially no conversations about gender identity and sexual orientation, will be expanded to 4th through 12th grade. And this is concerning because we know that we have our LGBTQ people that are sitting in these classrooms, and it is most important for them to be seen, heard, and understood in their schools, right? When we think about CDC's recommendations for a safe and supportive environment, this is not embodying safe and supportive environments for all people, regardless of their gender identity, sexual orientation, race, creed, etc. And so why should we care? I know you care. You have to care. You came here. I told y'all could have been anywhere in the world, but you're here with me. You should care because sex education really teaches young people the importance of treating everyone with dignity. Everyone, everybody, right? Teaching them with dignity and respect. And it really helps young people develop into sexually healthy adults. All young people deserve to see themselves reflected in school curricula. And we all should strive for a school environment based on science and objectivity that celebrates diversity and helps our students feel supported and affirmed. And those environments really help students strive for academic success. It's directly correlated. When students do not feel safe in schools, they're not going to excel academically. And what we know is that comprising young people's education by eliminating sex education or eliminating it really sets our young people up for failure instead of success. And so how can we address it? Right? Like that's a lot. That feels a little daunting, but how can we address it? Well, in the field, we're really, really hopeful because Biden has proposed a budget. His new budget really has modest increases to the teen pregnancy prevention program. It eliminates sexual risk avoidance, which is like synonymous now for abstinence until marriage programs. And there's a significant increase in the CDC DASH work, so the Division of Adolescent and School Health, really to focus on those 3 pillars that I told you, what works in school. And so we have more money going into CDC DASH funding, then we have more school districts that are able to apply to ensure that they are indeed providing safe and supportive environments for all young people. They're providing systematic referrals as well as opportunities for sexual health services. And lastly, they get the opportunity for quality, inclusive sexual reproductive health education. Additionally, Senator Cory Booker and Congresswoman Barbara Lee are going to reintroduce REA, or the Real Education and Access Healthy Youth Act, next month, actually. Next month, May, is Sex Ed for All Month. And so it's a month where we really uplift sexual reproductive health education throughout this country. And so they will be reintroducing it in the Senate and in the House. And this act would really fund teachers' training on sex education. I do that for my work day to day, but there is no federal standard for sexual reproductive health education for teachers. And unfortunately, there really is no pre-service prior to someone graduating with their bachelor's degree in order to make sure that they have the tools to get sex ed, to teach sex ed, right? When I did my dissertation research, one of the main things that my youth said to me while we had our focus groups was that the teachers are afraid to teach it to us. They are uncomfortable. And so if the teacher is uncomfortable teaching sex ed, that's naturally going to impede on how they share the information with their students. And so this law would really fund teacher training throughout the country. It also would provide grants for comprehensive sex education in both private and public entities to really focus on reproductive health. And it would also require, and not just encourage, inclusivity of our LGBTQ youth in our sexual health education programs. And so we're hopeful, right, that this will really come to fruition. And lastly, it will provide federal funding to programs prohibit federal funding to programs that are insensitive and unresponsive to the needs of our LGBTQ youth. So that was a lot. Let's recap what's happening. So we went through some sexual reproductive health trends. We saw, really what is sexual health looking like and experiences looking like for our high school students throughout the country. Looked at the Youth Behavior Risk Survey. We talked about what we can do. So CDC has a whole approach that they've been doing for almost 30 years around what works in school. Those 3 pillars that I mentioned. We looked at the 22 sex education topics that CDC recommends. That really is ideal. But what we know is that we really can't tell what every single teacher does in every single class, right? And we saw that maybe about 50% of our high school students are receiving this information, but as I mentioned, many of them only receive it freshman year of high school. What does policy have to do with it? It has a lot to do with it. There's extreme variability throughout the country on what sex ed looks like. Even in the state of Georgia, the state has mandates, right? So the Georgia state mandate says that instruction should emphasize abstinence and the abstinence until marriage and the fidelity within marriage. And every county interprets that differently. So there are some counties in Georgia that interpret that as, oh, that's abstinence only. We only talk about abstinence, abstinence, abstinence. There are other counties in Georgia that are like, oh, well, okay, if marriage is the goal, that's great. But let's also make sure that students have information about contraceptives. And so that variability then is limited to local interpretation. And that's why you see such different approaches in sex education throughout the country and even within states. We also looked at some sexual health policy trends. And why should we care? Like I mentioned, at the end of the day, young people really deserve honest, evidence-based, inclusive sex education. Who can address it? So we're hoping that Biden's budget, of course, it's a lofty, lofty goal, but we're hoping that it gets really published. We're hoping that they can come to agreement where we see more funding going into the field of sexual reproductive health, as well as hopefully, right, ideally, REA will be passed in the House and the Senate, and we can see laws that really standardize what sexual reproductive health education can look like throughout the country. So in closing, I just want to remind you all that numbers have life. They're not just symbols on papers. I know that it's very easy for people to come and share data and they're like, oh, look at what's happening among all students. But the reality is our LGBTQ young people are hurting in this country. There are stark laws that are coming to pass. So Florida is just the beginning of what we anticipate as very, very intense policies that are really going to alienate and isolate our LGBTQ young people. And so as you read this, as you hear this, as you participate in the session, I want you to actively try to put a face on a young person that you may know, whether they're LGBTQ plus or not, that is missing the opportunity to get inclusive sex education. And I encourage you to think about how can you be a change agent to ensure that folks get comprehensive sex education, even if it's not in a school-based setting. And with that, I am complete. I am happy to answer any questions you all may have.
All right, so excellent presentation, Dr. Thorne. If you could sort of unshare, there you go, so we could see everybody who's on, which is a lot of people. And we are now open for questions with Dr. Thorne. So please unmute yourself and go ahead.
Okay, so the question is, how can parents help and be assistive in this knowledge and sex education at home without pushing their narratives and feelings? Well, honestly, that's the parent's job, right? We encourage parents to, whatever values you have around sexual reproductive health, it is your job as a parent to instill that in your students or in your child, rather. And so I think parents should just be open to having honest dialogue. I always recommend, there are always those door openers. There are always things happening in society that's like, I wonder what my kid thinks about this. Use simple moments to have conversations, not only about sexual health, but just about things that's going on in their life. Ask them what do their friends think. No one wants to, I mean, I'm an adult and I never want to hear, I need to have a conversation with you, right? That doesn't feel good. And so how can you create natural moments with your youth and your young person to have conversations? Because the reality is they have access to a lot of information. They have many computers in their hands. And so if you're not having the conversation, know that they're having the conversation somewhere. I hope that answers your question, JJ. And I see this person has their hand up. I do not want to mispronounce your first name. Last name is Dalmasi, I believe.
Yes, thank you. It's Jen. The D is silent.
Okay.
So my question is probably going to sound a little bit long. Please bear with me. So it has been noted in the literature that the prefrontal cortex, which is responsible for good judgment, inhibitory control, and all those good stuff, is not fully developed until well into adulthood. So in my opinion, someone who is 18, which is an arbitrary age for adulthood in the US, is not even really a good a basis for thinking that, okay, we should expect this person to be responsible, to be able to do this and that, because some people, that area that should allow them to make good judgment is probably not yet fully developed. Now, taking that into consideration, how is it bad to say that we don't want to be discussing sex-related stuff with kids that are in middle school, preschool, like very little school, whatever grade that is? I'm thinking, yeah, as you mentioned, it's more of a reaction. You anticipate that this is a start and that is going to expand throughout high school, but is the fear that it may expand throughout high school should cloud our judgment into saying that we're opposed to it, we don't want this, we want freedom to speak about it so that kids can be educated about it? I think that's giving this group ammunition, because then they can say, you're being unreasonable because we're talking about kids, we're not talking about high schoolers. So will it be so bad to just discuss this and see that there's a place for it in our society? And if ever the discussion was to be about kids that are older, then we can discuss it then, as opposed to react right now and giving them ammunition because they are not talking about high schoolers.
Mhm.
That's my question. What are your thoughts?
Yeah, so thank you for your question. I leaned in because for some reason my sound is a little low. So I want to start off by saying their age and stage appropriate is important, right? And so we are not going to have the same conversations with our elementary students as we have with our high school students. With that being said, sexual reproductive health education is very, very inclusive of a slew of topics. And so I mentioned some of them earlier, but the conversations you're having at middle school may be conversations around puberty. It might be conversations around effective communications, healthy relationships. What does a healthy relationship look like? I think those conversations are necessary because we don't want to assume that every student has access to a parent or a caregiver that can provide them information about the changes that their body is going to go through. So I think what's most important is that the information is age and stage appropriate, but we all have bodies. We all have bodies that are going to go through things. And what I always say to parents is, you went through puberty, right? We all go through this. Our bodies go through this. And what I think happens is that people hear the word sex and immediately think that sex education itself is teaching the skill of how to have sex, when in reality, it really is life skills, such as refusal skills, such as how to be an effective communicator, how to ask for consent. Asking for consent doesn't have to only be with sex and sexual activity. Asking for consent can be, hey, can I borrow your pencil? And if I say no, then that's just it. And so there are a lot of life skills that come out of sexual reproductive health education or human growth and development education. But I think framing is important. And oftentimes when people are opposed of sexual reproductive health, they naturally just go to oral, anal, or vaginal sex. And it's way more than that. And I think if folks are open to learning all of the topics that sexual health education can encompass, they would be way more open to their youth getting the information.
I respect that. I respect that you say it is supposed to be age appropriate, what type of topic is discussed.
Mhm.
And I see a comment about their feelings should be validated. That is not my intention. I'm not saying the feeling should not be validated, but a kid that is in 3rd grade has absolutely no clue what actually they like. That for me is just not there. It's just not there. And I don't see how somebody can convince me unless you were to put every kid or take a representative sample and study it to prove to me, right, that kids at that age understand the difference between this is my sexual orientation, this is my why I need to know about all these things about sex. No, like we cannot just give them information and assume that, like all kinds of information, and assume that they will be able to pick out from it what is good for them and what is not good for them, what applies to them or not. We have to filter it until they are at that level. Yes, when they go into puberty, it makes sense to start having certain discussion because we don't want them to go and expose themselves to certain risks. But until we get to that part, I don't see anything wrong with making sure that, okay, this is not what we want to discuss with them right now.
Yeah, and my intention is never to sway your judgment. I think that, you have your own personal beliefs that perhaps are based off your lived experience. What I know is that I know people who are in elementary school or middle school who are very clear of their gender identity and also very clear of their sexual orientation. And so perhaps the young people that you are around, you feel that they are not prepared, or they are not ready to know whom they're attracted to. It says that many of us know the people that we're attracted to at very young ages. I will tell you, I am a cisgender straight woman. And in 2nd grade, I knew I liked holding little Daniel's hand when I had to hold hands and have partners in elementary school, right? And so what I will say is that, if you are a parent or a caregiver, etc., those are the values that you instill in your young people. But what's most important is that we make sure that even if our young person, we don't care that they get information about gender identity or sexual orientation, we create the spaces that at minimum, they have respect and also they respect individuals who identify as being LGBTQ. And unfortunately for many, because they don't have enough information about those identities, they end up shunning those individuals. And so I'm not here to like convince you that a 10th grader has the ability to make decisions about their sexual reproductive health. That's not my job. My job is to simply say that at the end of the day, young people deserve inclusive information, and the best ways that we as educators can provide that in the event that they don't have that access to that information at home, we should do that. The last thing that I will mention is our young people have access to way more information than we could ever imagine. And so although
That should be limited too.
make sure that they're protected and they may not be able to make those decisions, you better believe on that school bus, in that hallway, in those locker rooms, they are having conversations that oftentimes people would be shocked that they're having.
Mm.
Thank you
Well,
for your question and your comment.
Well, thank you. Sorry.
So there were a few comments in the chat, and I know people want to elaborate on those. I think it looks like a point was made that was addressed. Dr. Skurchin, you had an educational comment. I don't know if you want to elaborate on that or not.
Sure. I'd be happy to. Great response, Dr. Thorne. I really appreciate that. And I do want to make sure that we tack that affirming curriculum, especially in terms of gender identity, gender expression, is suicide prevention. We know that if there are affirming adults in a child's life, they are 40% less likely to attempt suicide. So I really appreciate your comments on that. And that also I want to make sure that we acknowledge that gender identity exploration happens around age 2. So I really appreciate Dr. Thorne's comment about knowing when she was a child. Same for me, we knew who we were attracted to at a very young age. But the comment that I made in the chat is in terms of good touch, bad touch. It's an evidence-based curriculum that's often taught out of rape crisis centers. I currently serve as the vice president of the board of directors for our center in Savannah, Mary's Place. And good touch, bad touch essentially covers the topics that Dr. Thorne mentioned in elementary school. And it is designed to detect child sexual abuse. So I love the comment Dr. Thorne made about how to discuss consent in a broad way, such as, you know, may I give you a hug? Asking, may I give you a hug? May I borrow your pencil? Etc. And I will say that after our prevention educators go into the school districts, we do get many reports of child sexual abuse happening in the home, because a child, especially at that age, is not going to know what's safe and normal and what is not. So that's why it's extremely important that we do offer comprehensive, medically accurate, culturally relevant sex education at all ages. And as Dr. Thorne mentioned, it really, you know, it's a wide range of what is age appropriate, and these conversations can be had in a way that helps those children understand not only just for their sexual health, but really just for their safety.
Thanks, Dr. Gemma.
Thank you, that's good. So we have a comment. I don't know if the person named Kathleen, do you want to say any more about your chat? If not, we'll go to Dr. Palacios. Ms. Kathleen?
Kathleen, I was just saying that in response to one of the previous comments about how, you know, maybe we shouldn't be talking about sex at all with these students if we want to protect them from it. But I think that regardless of what's taught in the schools, they are going to be exposed to it, whether it's like Dr. Thorne said, on the school bus or on the playground. Every child has, you know, the internet in their hand now, in their pocket at all times. We watch movies that spread incorrect information, you know, about what it means when a girl starts her period, or proper use of birth control. And they're going to be exposed to information, and it is not medically accurate or as Dr. Gemma Skirton said, culturally appropriate. So to have health education in the schools helps share the correct information, because there's so much out there and you're hearing so many different things, that to have an educator tell you what's true, or at least have conversations about it to help figure it out. I think that's really important in schools. Thank you.
All right, thank you so much for your comment. So Dr. Palacios, your hand is up.
Yes, I have so many things to talk about this topic. Thank you so much, Dr. Thorne. What a great presentation. Not sure if I missed it. I am a mom of a 4-year-old and a 6-year-old, and my 4-year-old is already asking about what happens when two people of the same sex get married. So I think that these conversations need to start when the child is asking these questions, right? Or even before. But anyway, the question that I have, and based on my personal experience, is that I don't know if I missed it either, but what is there any out there in these, sexual health interventions at the school level that is also incorporating the teachers, directors, and nurses? Because on many of these instances of sexual exploration, these happen also with teachers, and the way teachers respond, I think it's really important as well. So really curious to know how this is being incorporated into these, or should it be?
That's a really good question. So I would say at the elementary level, oftentimes the educator is either the physical education teacher and or sometimes a nurse, should the school be choosing to teach health education at the elementary level. We're talking about Georgia here.
Wow.
So perspective, right? But ideally they would go through training, right? And so that's where I was talking about the REA Act that's going to be reintroduced next month for Sex Ed for All Month. There really is no standard for the training and the skills that the educators have before they go into the classroom. And I think that's most problematic. Why? Because, right? Because they may not be comfortable. And honestly, many adults haven't had correct sex education. I have had conversations with adults, and let me tell you, okay, woo, we have failed many, okay? We have failed many as a society. And so what I will say is that there isn't a standard of training. I would encourage anyone, especially if you're a parent or a caregiver, to ask the questions. If sexual health education is being taught or human growth and development is being taught in your child's school, ask the questions, what does preparation look like? Are they just handing this educator this binder and these lesson plans and they just go? You as a parent or caregiver have the autonomy to ask to review the lessons, to ask questions. I encourage you to get on whatever board they may have. In the state of Georgia, they are supposed to review curricula every year to ensure that it aligns with the needs of the youth in that particular district and school. And so there is no standard. And to me, that's the most problematic, because we have folks who they have their own personal values, which is fine. We all have our own personal values, but some of those personal values are being superimposed on the students. My work prior to transitioning into my role at Advocates for Youth was supporting Georgia counties around sexual reproductive health. And I had to sit in trainings where people were like, I'm not teaching this information because I believe that people need to wait until have sex until they're married, or I think being gay is wrong. And so because I think being gay is wrong, I'm not going to teach this LGBTQ inclusive lesson. That's what I had to come up against. And so I encourage any of you who are caregivers to ask the questions, because then you'll get a better idea of who is teaching your youth the information and what level of comfort they have. Because then that kind of lets you know where the gaps may be and where you may need to fill in as a parent.
Well, I mean, I think that overall, I don't even need to ask the question, at least from my personal experience.
I want to also share with you, we have one of our projects is amaze.org. It's little video vignettes for parents, for youth of all ages on a variety of topics, like literally anything you can think of, from menopause to LGBTQ inclusivity to I had my period, what does that mean? What does it mean to be trans, same-sex relationships, as well as what does it look like to get consent? What does it look like to give consent? And so Amaze.org is a great resource to even have that conversation starter. Hey, let's look at this 2-minute video together and learn about a thing, and then you can answer questions. So encourage you all to check out Amaze.org also. For your littles.
Thank you so much.
No problem.
That's all.
Okay, thank you, Dr. Thorne. So, same topic, different topic, people want to bring up?
Just one last thing, unrelated. Can I ask you to list your email in the chat? I would love to send you an email. I have some questions that I would
Yes,
love
happy
ask
to.
you.
I'll drop it in now.
Thank you.
Okay, so Dr. Thorne, I just want to bring up one question, given everything that's been discussed so far. One of the big challenges, which is probably very obvious to you, but not maybe not so much to everyone else, and it'll be great if we can put it in our recording. It's like, what is your strategy for engaging and having a real conversation with people who essentially don't agree with you? You know, that has been the case for a really long time. That's why policies exist the way they exist. The forwarded bills didn't come out of the blue, and other works that people have different beliefs. People have different ideas on what makes a child, what doesn't, you know, developmental issues, physical issues, histories, all the things you brought up, you know, so those are all critical. However, our goal in public health, as you know, is prevention, as well as education and as well as assessment. And so it makes it for a real challenge. You have expert persons working on these different programs. You know, the DASH has been dealing with this for decades. However, DASH doesn't work if the persons implementing the programs are real challenged by that. So my question is, what is a strategy that you use, first of all, to addressing that? And then second of all, what do you do for yourself to take care of yourself after some of these discussions, which, you know, I can, you know, from my own experience, know can be pretty exhausting sometimes, and not necessarily in a bad way, but just in a challenging way. Make sense?
Great question, Dr. Telfair. Let me just let you all know, Dr. Telfair has been asking these type of questions since my entire doctoral program. Okay, so firstly, the strategy is safety. That's the strategy. The strategy is, don't you want young people safe? I think Dr. Gemma really mentioned it and hit the nail on the head in regards to sex education is safety prevention. If our young people do not know the correct anatomical names for their body parts, they're unable to tell folks if someone has touched them inappropriately, right? And so I always lead with safety. So that's violence prevention. It's also safety in regards to knowing how to give and how to get consent, right? What does that look like? It's healthy relationships. We don't want our youth in harmful relationships, potential interpersonal violence in their relationships. And so I always lead with safety. As Gemma mentioned, suicide ideation and prevention is huge. When we're talking about our LGBTQ youth, we know that they have higher risk of suicide ideation, higher risk of mental health illness. And so again, safety. Sometimes for educators in just that realm, you have to meet them where they are. And so I always pull the data, right? What are the suspensions looking like? What are the absenteeisms looking like? And what are some ways that we can prevent them? And there's oftentimes an overlap between social emotional learning or lack thereof and the need for sex education. So I pull in the social workers, I pull in the counselors to really provide stories behind the numbers. And really that kind of helps make the case. In the Georgia school districts that were very like anti all things inclusivity, at minimum, we were able to get them to agree to sexual reproductive health anatomy, right? We want our young people to know about their anatomy. So they would agree to that. They would agree to healthy communication. They would agree to conversations around consent. sex trafficking prevention. And so I always lead with safety, and then try to incorporate inclusivity for districts or for educators who are very adverse to the level of inclusivity that I provide. As far as what do I do for myself, I have just really came to a place where I understand that this is my life's work. And so it honestly brings me joy. I love having the hard conversations because many people, similarly to me, I have very strong values and affirmations about this topic, but I understand how others can feel very opposite to others, right? So I can understand the religious perspective and one saying like the Bible says this and Adam and Eve and not Adam and I get that. Why? Because I grew up in a Pentecostal school. I very much so love Jesus. And so I get that lens, but also we got to save these babies. Right. And so it doesn't exhaust me to have these conversations. I think if I can have a conversation with someone who's opposed to sex ed and just get them thinking a little bit differently about what sex ed looks like and what does it mean and what does it include, then I feel like that's a win for the day. But I don't feel exhausted in this work because I really feel like it's my life's calling.
Yeah, I guess, you know, knowing you as I do, the exhaustion is not necessarily you, you know, it's the energy is there. I was joking to one of your colleagues that if the two of you are in the same room, if I wanted to lose 5 pounds from just discussions, I could definitely. So,
That is so funny.
Yeah, it is. Anyway, so I appreciate that. So we are sort of, yeah, Tanja E. Jules, Miss Tanja E. Jules on that one. Anyway, so anything else? Anybody else want to make a comment? The question?
Just a comment. It has nothing to do with anything but me. And I'm honored to have Dr. Thorne on my committee, and I just want everyone to know. So yes.
Thank you, Tanya. Oh, this has been amazing. This is a full circle moment for me.
Okay.
Really happy to be back at Jiann-Ping, even virtually, to share a little bit of my work, and grateful for the college for really instilling the values around inclusivity, public health, education. And I'm just grateful to come back and share that knowledge with you all today. So thank you.
That's right. Who knew a Brooklyn girl could fit in with us, right? Anyway. So to do that, well, we are truly, truly grateful, and obviously, people stayed on the whole time, which just speaks to you, Dr. Thorne. And in the chat is lighting up with comments for you. So we want to thank everyone who asked phenomenal questions, even though you were, you know, those that were a little hesitant or even being willing to just share a perspective that is their own. Really challenging many of us to really think through kind of how we communicate. So we appreciate that. And thank you all who asked the question. Dr. Thorne, thank you for taking the time, you know, to speak with us. We're grateful. And I think the audience is grateful on that end. So I want to thank everyone. And this was our last grand rounds for this semester, and we will definitely work hard for the next semester in the fall to bring these back. We have ideas, suggestions, and other things. We'll reach out to you. And many times we'll reach out to you, your alum, like Dr. Thorne. So thank you all. Thank you. Have a good rest of the day and rest of the week. We, again, will post this. We'll post the recording. Well, Dr. Thorne has agreed to share her slides with us. And then we will have that again if you want to share it with this. So, Dr. Thorne, have a blessed day. We'll appreciate it.
Take care.
Okay.
Bye.
Thanks, everyone.